Hey everyone, this is KT Dechert, and welcome to my presentation of trauma-informed care with therapeutic interventions. So my chosen species is Canis lupus familiaris, commonly known as dogs. My breed of choice is American Pit Bull Terrier. My field of choice is mental health support in trauma-informed care with the help of psychiatric service dogs for those who have PTSD. So what is trauma-informed care? For humans, the definition of trauma informed care is an approach that recognizes the widespan impact of trauma and understands how it can affect a person's behavior and well being instead of focusing on what had happened to that person. It emphasizes on creating a safe, supportive, and empowering environment to promote the healing and resilience for that person. Now, on the end of dogs, the definition is the understanding and responding to the effects of the past trauma on their behavior and well being while focusing on creating a safe and supportive environment to help them heal and build trust. We emphasize on recognizing that a dog's internal and the extreme reactions may stem from trauma that they required in the past, and we want to be compassionate, present, and consistent approach to their care and well being for the dog. So, some of the potential problems and challenges that I might run into are the problems with aggressiveness, dominance, and shyness in dogs, along with nervousness and hyperactivity. Some of the challenges that I will feel I will occur is the acceptance of American Pit Bull Terriers as psychiatric service dogs, along with the misconception alone of pit bulls. Some of the benefits of having a psychiatric service dog is the emotional, social interaction, and the biological aspect that they can give. They help what's called break the ice in therapy sessions. It helps them open up to their therapist. They offer a non judgmental approach, which helps the person have a social or who do have social or trust issues. This helps build their social skills and helps reduces the stress and anxiety. So in the training, all service dogs need to have basic training of sit, stay, come, and heal. With psychiatric service dog trainings, they need to be able to do deep pressure therapy, which helps with the reduction of anxiety. Grounding techniques that helps the handler stay present and focused on that situation. Medical alerts and reminders, they need to be able to remind their handler to take medication. They're also trained for interpretation for self-harming situations and behaviors that their human might do, and space creation. This training helps the handler. What the dog needs to do is keep a distance between their handler and other people around them so their handlers feel safe and doesn't build up anxiety. The operant conditionings are association and consequences, negative reinforcement, positive reinforcement, and shaping desired behaviors. What this all means is on the aspect and when we do a positive consequence, we're going to reward our dog with a treat or toy for giving us the behavior that we want. We want them to remain calm. They stay calm. We give a treat or toy. With a negative reinforcement, the unwanted behavior we're not going to reward for. So the positive reinforcement, when we do get that behavior, we're going to reward. This helps our client build their trust with their service dog. The shaping of behavior, we want to shape the specific behaviors we're looking for the specific client's needs. We also have building trust and safety. We want to create a positive and productive environment that helps build their bond between both the dog and the handler. It's crucial for trauma survivors who do struggle with already having trust and safety issues in relationships. We want their relationship to be strong. Empowering the dog's training. This can also empower the dog with a sense of control. It gives them the confidence and the well-being to help improve their therapeutic partnership between both the handler and the dog. Positive reinforcement. We want there to be a good well-being between the two. We want to enhance the well-being of the dog. This makes the training stimulating and a positive experience for both the dog and the handler. Trust. Strengthening the bond between both the handler and the dog. Their relationship is built strictly on building trust and mutual understanding. At all costs, we try to avoid negative consequences. Positive reinforcement helps promote a safe and supportive learning environment. The positive punishment can cause issues with trust and cause fear. Interactions. So the interactions that will take place in AAI settings with a psychiatric service dog is the emotional support and comfort that they offer to their handler. So while the handler, you know, may have anxiety, they'll help reduce anxiety, increase the sense of safety, and they offer a non-judgment communication. Assistance with therapy and treatment, they encourage encouragement, building a rapport with their therapist, communication, guarding techniques, again, helping the client be present, interpreting harmful behaviors, and motivating participation. The the interactions like petting, stroking, hugging of the dog, structured activities, and deep pressure therapies. Thank you again. This is KT. I hope you enjoy. Thank you.